Hi, this is Lysett, and I am doing my skills evaluation number 4 for Health Assessment Lab. I'm going to start off by doing a 360 of the room that I am in. My patient is sitting. Okay, I'm going to set my laptop at a good position. Bottle of water just fell. Have my pen light here. Hand sanitizer. Hi, my name is Lysett. I am going to be your nurse today. I am going to get you to start off by verifying your name and date of birth, please.
February 21, 1998.
Thank you. We are going to be doing a neuromusculoskeletal assessment on you today, okay? So I'm going to be asking you a couple of questions. Can you tell me today's date?
Tuesday, April 21, 2020.
Okay, and where are you right now?
My house.
Okay, so patient is oriented ×4. I am going to check your pupil now. So I'm going to get you to look at me straight ahead, please. And again. And again. Okay. Pupils are both equal, round, equal, and reactive to light. Now I am going to get you to stand up for me, please. And I'm going to ask you to take your t-shirt off, please. Sorry, I'll be moving my laptop around a little to make it comfortable for a good position. I'm going to get you to turn around for me. And I'm going to get you to bend forward and touch your knees, please. Okay, so I am inspecting the scapula and the hips for equal height. I am going to palpate, and it is equal symmetrically, and it is symmetrical bilaterally and equal height. I am going to palpate down the spine. Okay, you can stand up for me. So no kyphosis or scoliosis was noted. I am now going to inspect your, if you could turn around for me, please, your trapezius, shoulders, triceps, turn around, please, biceps, elbows, and wrists, and your hands for color, symmetry, swelling, size, and deformities. And I see no erythema, no swelling, no deformities noted, and it is symmetrical bilaterally. Now I am going to palpate for temperature, tenderness, or masses. So I am going to ask you to turn around for me again, please. I'm going to start off by palpating for temperature. So I'm going to palpate the trapezius, the shoulders, the elbows. Turn around, please. Your wrists and your hands. No warmth noted. Now one more time, turn around, please. Now I'm going to palpate for tenderness in the trapezius, shoulders, triceps, turn around, biceps, elbows, wrists, and fingers. No tenderness elicited with palpation, and no masses noted. Now I am going to ask you to squeeze my fingers, please, as hard as you can. Thank you. So now I am going to ask you to do a range of motion of the neck with me, okay? So we are going to do a flexion of the neck, extension, just straight ahead. And now we're going to do lateral left, lateral right. I'm sorry, that was rotation left, rotation right. Now lateral left, lateral right. Thank you. Now I'm going to do shoulders. So with shoulders, I'm going to ask you to do flexion, extension, hyperextension. I'm going to get you to do abduction, adduction, internal, external. Thank you. So now, no limitations of range of motion noticed. And once again, I'm going to ask you to squeeze my fingers, please, as hard as you can. Okay? So strength is equal bilaterally. So now, I'm going to move this a little closer. I am going to inspect for, let me see if I can move that a little bit. So I'm going to inspect the quadriceps. Now can you sit down for me right here, please? That was the quadriceps. The calves. Put your arms up. The hips, knees, and ankles. For color, swelling, size, symmetry, or deformities, and I note none. No swelling and no deformities noted. Now I am going to palpate. And this is going to be for temperature, tenderness, and masses. So I'm going to get you to stand up for me again. So with the inspection, no erythema was noted. So now I'm going to feel for the warmth. And it's a little hard to do this with the shorts on, but I would do no warmth in the quadriceps. Sit down, please. No warmth in the calves, hips, knees, and ankles. No warmth. No warmth. I'm going to start by palpating down here since I'm already down here for tenderness or masses. None at the ankles noted. The knees. The calves. Stand up, please. The hips. And the quadriceps. No warmth noted, no masses, and sit down. And no warmth, no masses, and warmth, masses, and no tenderness elicited with palpation. So now I'm going to move my laptop a little bit more, And I'm going to get you to lie down for me, please, with your feet this way. I'm going to move this one more time. So now I am going to get you to press down for me, please. Okay, press down. All right, force is equal bilaterally. Now, I am going to do hip rotation, okay? So I'm going to try to find a good position for this without me blocking it. Okay, so I am going to start off by doing flexion and extension of the hip. So I am going to lift the knee and I'm going to do flexion, extension, internal, external. We're going to do abduction away, adduction. The same with the other one. So I'm going to do flexion, extension, internal, external. I'm going to do abduction away, adduction in. And that was it. Thank you.